Fibroids are non-cancerous tumors that affect the uterus. They can have different locations that can produce different symptoms. Typically, there are three types that we tend to see. Fibroids that involve the inner lining of the uterus, and that's called a submucosal fibroid. There are fibroids that embed themselves in the muscle or the walls of the uterus, and those are intramural fibroids. And then we have some that can just kind of sit on a stalk on top of the uterus. But they all can cause different symptoms depending on location. What we tend to tell patients is that fibroids typically are not cancerous. They won't turn into cancer less than 1% of the time that happens. But they can be somewhat of a nuisance. They can cause symptoms that run the gamut of heavy, irregular bleeding to painful intercourse to constipation. So the symptoms are varied depending on location. And we find that not every person will have the same symptoms or be affected the same way from uterine fibroids. There's not one specific treatment that will be beneficial for every single patient. Treatment options include, however, surgical options, which include the myomectomy, which is a procedure that calls for removal of the individual fibroids while leaving the uterus inside. And then, of course, there's a hysterectomy where the uterus itself is removed. We have less invasive procedures called the uterine artery embolization procedure that is done by the radiology department. That also is a method of dealing with immediate treatment of uterine fibroids. Although it's not a lasting treatment therapy, it can sometimes bridge the gap between patients wanting to do something that's a little bit more invasive. And sometimes it will give them, a resolution to their symptoms for a period of years. There are emerging technologies that we will start to see that are being developed for the management of fibroids, because at the end of the day, what you want to do, you really want to try to keep a woman's fertility intact, or you want to keep her pelvic organs intact, with surgery being, or definitive invasive surgery being a last resort. So I think that we're going to see new techniques and new technologies that will be brought on board that will manage fibroids and manage them conservatively, less invasively, giving women the options of having something else to do than leave the hospital with, a large incision and a large time for recovery.